Thank you for joining us today as we review the Blue Cross Blue Shield firm analysis. This was done in conjunction with Josh Lonardi, Asif, Mazhar, and Andrew Gonzalez. A brief overview of this presentation is that we will be focusing on the examination of Blue Cross Blue Shield and how it leverages business intelligence. We'll explore the current use of BI at Blue Cross Blue Shield and assess the state of BI at Blue Cross Blue Shield. And then subsequently, we'll explore the future of BI at Blue Cross Blue Shield. So business intelligence today at Blue Cross Blue Shield consists of the Access database, claims analytics contest, and blockchain research. So when we talk about the Access database, it's not Access like the Microsoft product, it's actually the Access database, and it's actually developed in 2015, and it was essentially the largest database in the healthcare industry. And it compiled information from all the member companies that are made up under Blue Cross Blue Shield's umbrella. This massive database provides information on billions of procedures and the majority of hospitals which are part of the Blue Cross Blue Shield network. Information was also collected from multiple claims and millions of providers. So when you think about this Access database, it serves as a massive system of record for the organization, which could be utilized for business intelligence activities and for analytics. So as I talked about, there were beneficiaries of the Access database. There were providers, and providers essentially could utilize the data to deliver more coordinated and patient-centered care. And they could even use this information for their own analytics and inquiries into customers and activities. Secondly, there was customers and employees who also could benefit from the Access database, because essentially we give them the Access database gives them options for comparing services, hospitals, and doctors. But it also opens up valuable information into, the health of customers, and employers could look in trying to look at the health of their employees in a sense of being able to see what's a service they need to provide, what's the majority of the users in the health care opportunities or benefits that they provide. What do they use the most? What do they need to make sure they have covered? And lastly, obviously, Blue Cross Blue Shield benefited from the large amounts of data. And as I alluded to earlier, because this large amount of data allows them to do a lot of testing, develop statistical models, develop analytical models, develop, a strong pool of information from which various information products can be developed. So we see there's several beneficiaries of this Access database, but it can be expanded into many more facets of multiple business and business users. So as I alluded to earlier, the Claims Analytics Challenge, which was offered by Blue Cross Blue Shield, was a groundbreaking method that the organization pursued to improve its claim data analytics. And so what essentially the offer was a challenge for innovators to show what they got in the sense of what's their technology, what's their approach, and how can it be applied to Blue Cross Blue Shield's Access database or a subset of the Access database's data. So competitors gained access to claims data and provided, their findings to the organization. And the goals were to essentially find solutions to several high-value case studies or cases that the organization was looking to be resolved. In addition, the overall goal was to increase access to healthcare for all of their customers. And lastly, there was also an imperative need to make the healthcare industry more effective in using data. So it was kind of like a training exercise, if you could think. But what was interesting was that the entrants were essentially paid in data. It wasn't, money that was brought forward and presented to them. No, it was actually data, which shows a new kind of value in data being a monetary standard. And now I'll hand over the discussion over to my colleague, Asif, who will talk a little bit more about the blockchain evaluation.
Blue Cross Blue Shield has made quite an effort to stay at the cutting edge of technology, but not only that, they have made an effort to improve and to streamline the healthcare industry as a whole, specifically data exchanges. The vastness of the healthcare industry has created a multitude of issues just in regards to the transference of data. Um, uh, Tracking data has become quite difficult. From patient to doctor, from doctor to the hospital, and from the pharmacy, uh, from the hospital to the pharmacy, and then back to the patient, and ultimately back to the uh, healthcare provider. There can be errors, misrepresentations in any uh, parts of that process. Um, so to stay on the cutting edge of that technology, Blue Cross Blue Shield has begun to look into blockchain technology. A division within BCBS is called NASCO, which the whole sole purpose is to evaluate the different frameworks, the different types of technologies in regards to blockchain, among other things as well. But they have found quite some success in that. With just an estimated cost of about $2 billion annually, it can be quite expensive to cover data management for corporations or companies within the healthcare industry. A blockchain-enabled framework could reduce those costs significantly. Going forward, BCBS is attempting to stay on the cutting edge of technology, just due to the size of the company and the amount of data that BCBS is responsible for. It's important to stay. It's important to be at the cutting edge of this technology. And just onto the assessment of business intelligence at BCBS. So there's the scale I had mentioned before about the scale of data that companies such as Blue Cross Blue Shield covers. Having that much, being responsible for that much data and analyzing that much data, it essentially requires an organization the size of Blue Cross Blue Shield to invest in some sort of business intelligence capability or platform, just to analyze all of it, to develop some sort of plan, and to essentially come up with some way to get a return on their investment. The health industry as a whole, especially established insurers that have been here for quite a while, such as Blue Cross Blue Shield, they were initially behind the curve on utilizing business intelligence platforms and tools. But among other things, the push from the government, from government mandates and from laws that were put into place to lower costs and to increase coverage for citizens of the country, it kind of forced companies such as BCBS to move into the world of business intelligence. Today, Blue Cross Blue Shield is engaged in using a multitude of tools, such as tools for BI, for big data, as I mentioned before, exploring blockchain, and linking data from vendor to customer, creating competition for analytics. It shows that BCBS definitely has a commitment to growing the business, to growing the healthcare industry as a whole, but more importantly, to help the consumers. In regards to the analytics maturity curve, as in the previous presentation we spoke about, we covered the analytics curve and the four placeholders: the descriptive, diagnostic, predictive, and prescriptive. Those are the degrees of business intelligence. We would put BCBS in stage 2, which is diagnostic. Even though it's made incredible leaps in utilizing and establishing a business intelligence in such a short amount of time, it still has some time to get to the prescriptive phase, if it will ever get there. It's extremely difficult to use predictive and prescriptive analytics in a company or organization such as BCBS. we can definitely see that BCBS will continue to deliver more value for their customers, just from how invested they are in utilizing business intelligence in their organization.
Hi, my name is Josh Lonardi, and I'm a member of the group that chose the health industry as our midterm project and Blue Cross and Blue Shield as our specific organization within the health industry. I'm going to be focusing on the future of BI. Part of the history of the health industry was that due to government mandate, they were forced into investing into business intelligence as well as other technologies to lower the cost and improve improve the standards and the ability to help the American people. This allows for an extremely large growth within the health industry as well as Blue Cross and Blue Shield. Basically starting from scratch where nothing was recorded. The interactions between the companies as a whole within the industry was not highly utilized. And we've seen an explosive growth within the last 5 to 7 years. Some of the future BI investments at Blue Cross and Blue Shield, we're already starting to see is artificial intelligence. They're utilizing it for image recognition and analyzation of MRIs and CAT scans. Health research can be sped up. Artificial intelligence, they're predicting, can be used in blood samples. So you don't need a technician to do it. You can have AI perform all the necessary requirements. They could do it with more speed, more efficiency. Telehealth and Internet of Things integration allows for patients to easily access care they need, have health KPIs be shared with doctors, large amounts of insightful data created. We're seeing this all across the planet right now. You have the elderly or people who cannot get to the hospital or the doctor's office. They might go to a clinic or somewhere closer, or even from their home, and technology is being created where you sit in a chair and it will take your blood pressure. It will interact with your heart rate. It can check your weight, and the doctor can read all these stats on their screen, can talk to the patient through the computer, through applications like Zoom or FaceTime. And this is a way to, you can't make a full diagnosis, but it's a start. And especially if the doctor's just trying to keep in check with a patient, it allows for just a more personal interaction and the ability for the doctor to be there 24/7. Another big one we've discussed in the midterm is wearables. Wearables, someone who's, going through a specific treatment, they're now creating wearables or devices they implant on the skin where the doctor can track this information 24/7, wherever they are, wherever the patient is. They could see spikes, they could see declines, and they could react to that. Another one is robotic process automation, creates a digital workforce that works with the existing workforce to drive efficiency. Think of speedier claims processing. All of this is taking the workload off of the essential staff in the health industry in Blue Cross and Blue Shield, and you're sending that to an automated system, allowing for the employees to focus on more important issues in certain claims with specific patients, customers that need that attention more than just doing the frivolous, ongoing standard claims. Future state of BI at Blue Cross Blue Shield, it's going to continue to move forward. Business intelligence, they're mining big data, analytics to discover valuable information, AI to help process all of this billions of information, billions of data points. They're collecting across the United States. They're international, contingent. BI is really giving this unique ability to collect all this data that is new to Blue Cross Blue Shield, the stuff they were not utilizing 10 years ago. And using that data to not only prevent disease in the future, but to bring the information closer to the patients, and the patients can see their own information. The patients can see what their stats are and to see how they're going, if they're, if they're improving, if they're declining, what they can do to make their health better, to make their lives more efficient, cost savings for Blue Cross and Blue Shield, and life savings for the customer. We're going to see a lot more of this. We're going to see, I think in the next 3 to 5 years, if you're a member of Blue Cross and Blue Shield, you're going to have that data on your phone. It's going to be easy to read. They're improving it all the time. You're going to FaceTime your doctor. They're going to check in with you. This is where we're headed. The less time that's needed to go to the doctor's office is cost savings for both you and these businesses. And it's all about prevention now. No more adapting to the problem. It's preventing the problem. It's seeing the problem before it happens. Predictive analytics is something that would be very hard to utilize in the health industry, but I think they're going to start seeing, hey, these numbers are increasing. If based off of our previous knowledge from the past on you, on other customers that are similar to you, if we change this now, you won't have these issues in the future. And that's what this is all about. It's about utilizing technology to not only make a business more profitable, but to make life more profitable. And that's where I see Blue Cross and Blue Shield headed. We just want to thank you for your time. Thoroughly enjoyed